Today I'm going to talk about the contraindications and disadvantages of removable appliances. Removable appliances can be great for simple corrections, but they have their limits. Before choosing them, you need to understand two things: disadvantages and contraindications, situations where they simply can't be used. Let's start with the disadvantages. Biggest one is the patient cooperation. Compliance is the key to success. Unlike fixed ones, the removable appliances can be left outside of mouth and can be broken or be lost. Next, it offers limited control over how the tooth moves. Only tipping movement is possible. Good laboratory work is needed. The quality of fabrication of the appliance is crucial. Low-arch appliances are difficult to tolerate due to interference with tongue and speech. Also, they are inefficient in multiple tooth movement cases. Now let's move to contraindications. First, it is not suitable for closing extraction spaces by moving the posterior teeth forward. This type of bodily movement requires root control that only fixed appliances can provide. Use of intermaxillary traction is not possible. That is, the procedure that requires connecting elastics between upper and lower jaw for the correction of problems like severe class 2 and class 3 relation is not possible using removable appliances. Finally, it's difficult to obtain tight proximal contact between teeth using removable appliances. In short, removable appliances are great for minor corrections, but they require high commitment and are inefficient for complex movements.